Hi, I'm Dr. Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. The topic today is postoperative care after an abdominoplasty or tummy tuck. Okay, the postoperative care begins in the preoperative time, usually about 30 days ahead of time. So I'm going to refer to some notes as we go through this that's also on the blog. 30 days beforehand, I'd like you to start taking an iron tablet and a supplemental vitamin. Why? Because the blood loss during an abdominoplasty is consistent with a heavy period. By having the iron on board, now you'll recuperate faster. Also, from a wound healing perspective, we want to have all the nutrients available there for you. We want to have you stop any hormones, female hormones, not thyroid, but female hormones. Why? This has a chance of increasing blood clots during this time. Right at the day after surgery, you can start getting back on your hormones. We also would like you to stop taking aspirin, ibuprofen, or supplements. If you do get a headache, you'll take like Tylenol. Now, why the supplements? The supplements can cause problems like St. John's wort, or some of the other supplements like high in vitamin E can cause bleeding. Okay, we also want you to stop smoking 35 days ahead of time. Why? Smoke acts like a constrictor on the blood vessels and prevents the healing hormones and the antibiotics from coming into your system. If you're over age 45, we want you to get a preoperative clearance from your family doctor for testing. Okay, we're going to move on to 2 weeks before surgery. You're going to meet with us here in the office. We're going to go over all of your preoperative medications. We're going to examine you. We're going to go ahead and check your laboratory, and we'll perform some laboratory tests here in the office to make sure that your hemoglobin is high. And again, no aspirin, ibuprofen, Aleve, or Motrin. Now you've got all your prescriptions. You've got all your instructions that we're going to give to you at that time. Now, we're now 4 days beforehand. I want you to go out and purchase 2 big bags of frozen peas or corn. Why? You're going to put those into a pillowcase. One will go on your tummy. As it thaws out, you replace it in the freezer with the new one. It will conform to your abdomen like a bean bag and really help with the pain. No shaving of the pubic area. It's been shown that shaving can increase the chance of infection. We'll shave you if necessary at the time of surgery. Make arrangements for drop off and pick up with your family members. The day before, 3 days before rather, we're going to have you start our antimicrobial decolonization program. Because there's superbugs out there, we have come up with a program to help eliminate those. So you will take a shower in the morning and in the evening with Hibiclens, chlorhexidine, over your breasts and your tummy and your legs. You'll also have this antibiotic ointment that you'll put inside your nose, your ears, and your tummy button. That kills the superbugs where they hide. Okay, we will be providing you bromelain and arnica. B for before, B for bromelain. A for arnica, A for afterwards. 3 days before, start the bromelain. Okay, the day before, make sure you have everything lined up. We'll want you to make a list out that night before surgery of any questions you might have. You'll take your decolonization, no alcohol that night before. You'll call the surgery center to make sure that everything's in line there. Okay, that morning, now you're going to get up. You're going to put this little patch behind your ear. This little patch lets out long-acting anti-nausea medicine. It's called scopolamine. We usually use it for deep sea fishing, cruises. The downside, it can give you a dry mouth. Dry mouth or nausea, I'll go with dry mouth. It's good for 3 days. So if after surgery the next morning you're not nauseated and your mouth is dry, take the patch, put it on wax paper or tin foil, and you can put it back on if you have nausea. Just wash your hands good, because if you touch your eyes or somebody else's eyes, it will dilate the pupils. It won't hurt anything, but it sort of causes people some concern. Okay, the morning of there, you arrive. You're going to come in with loose-fitting clothing. You're going to be able to come in with any questions that you might have. At that time, I'm going to see you. We'll review all your past medical history. You'll meet with our anesthesiologist. You'll meet with our nursing staff. I then will mark you all up. I will have you bring a pair of panties or a bathing suit so we make sure that the lines stay within the hidden areas. Okay, we take you back and you have surgery. The next thing, you're going to be in recovery room and you're going to say, "Who punched me in the tummy?" That's because your abdomen is going to be tight as steel. We're going to bring those separated muscles together. We're going to take off that extra fat. We're going to liposuction the flanks. You'll be in the lawn chair position, and we're going to give you a walker for the first 4 days. Why? You're going to look like the little lady of Pasadena, because we're going to make you so tight that you will feel really good. Because at first you're going to say, "I'm too tight." 3 months later, perfect. 6 months later, "I wish he had made me tighter." But by doing this and having the walker, it keeps you from separating the wound. You'll go home with these stockings on. They prevent blood clots. You'll also go on with machines that go on your legs that will gently massage your legs. And you'll wear those for the first 2 weeks as long as you're not walking around, only when sleeping and taking a nap or in a recumbent position. It helps prevent blood clots. We have a little machine that helps get the anesthesia gases out of you that you'll use afterwards. You'll have a couple little drains that will give you a chart to show how to take out the fluids so you don't get a hematoma. You'll also have a catheter in your bladder, and we'll show you how to take that out. It's like falling off a log. Okay, now you're stable to go home to recovery. We'll help you get in the car. We'll have your significant other or loved one will help you get to the house. We'll be calling you that night, and you'll start taking your medication. Now, when you leave the surgery center, you can start your medication that you were taking beforehand, whether it be birth control or female hormones or whatever. Let's say that you get home at noontime. So it's at noontime. You're going to go ahead and take a Percocet, the strongest acting pain medicine we have. Now, at 3 o'clock, you're going to take ibuprofen, Aleve, or Motrin. If it's ibuprofen, 800 milligrams. At 6 p.m., you're going to take a Percocet. At 9 p.m., an ibuprofen. Now you can have something every 3 hours. You'll put the frozen peas over your abdomen. And we also include a non-narcotic pain pump. This non-narcotic pain pump will be strapped around your neck in a little fanny pack. It has a bulb, and for the next 3 days will drip Marcaine, like Novocaine, right on your pain nerves. It's a non-narcotic, so you can even drive with it. Now, as time progresses, usually in 7 to 10 days, we start taking the drains out. At 4 days, you'll be able to stand up straight. Most people are back to work anywhere from 10 days to 2 weeks. Some of the more extensive operations, 3 weeks. Now, exercise. Once the drains are out, once everything is settled down, we let you go back to the gym. For the first 6 weeks, as long as it doesn't hurt, you can do anything you would like. After 6 weeks, there's no restrictions. You can do anything you would like. During this time, we also start our anti-scar program, where we use what's called Embrace, a device to hold the scar together. Then we'll use silicone gel. Then we have lasers, etc. During this time, you'll wear a Spanx to help with the fluid accumulation. Because what happens is, this fluid, it needs to get out of the areas I've done the surgery. And by compressing it with a compression garment, it will get it out. Now, at the end of 8 to 12 weeks, you're starting to really look good, and you can really start toning and enjoying your body. So, in summary, we've talked about postoperative care, but it really begins with the preoperative care. So, please look over the blog. We really would like to see you in the office here. Read our website, and please come join us on our social media site, which is very active. Thank you, and we hope to see you very soon.